Good evening. My name is Nageshwar Reddy. I work at the AIG Hospitals in Hyderabad. Today is the World Organ Donation Day, and on this World Organ Donation Day, the AIG has arranged this program for the presidential voices to be heard about this. In fact, organ transplantation started way back in 1960s. Since then, there's been dramatic developments in this area. There's been drug discoveries, there's been several new technology developments that have occurred to make organ transplantation a reality. In fact, this is considered as the most remarkable advance in medicine in the last 70 years. It's not only life-saving but cost-effective, as other modalities of therapies can come down completely. Over the last few years, organ transplantation has earned cultural acceptance, legal and political assistance. But there's also been tragedies associated with this. There have been several other issues that come up with organ transplantation. For example, in India, we require 3.5 lakh people who require an organ, but every year only about 11,000 transplantations are done. So there's a huge gap which needs to be filled. To get people to be aware about this and also to realize the importance of this organ transplantation, AIG has arranged this program where all the presidents of all the top societies come together to voice their concerns about what is happening in this area, to motivate and encourage people to discuss these issues. And we have presidents from various societies who will come on and talk to you about these aspects of organ donation. We will start first with our first group, and this is going to be moderated by Dr. Narasimham, who has been actually the former president of Indian Society of Electrocardiology. He is the director of electrophysiology services and director of cardiology at the AIG Hospitals. He will be assisted by Dr. Rohit Dama, who is associate director, Department of Surgical Gastroenterology at the AIG Hospitals. Dr. Narasimham.
Thank you very much. I think this has come at the right time because there is an acute need for developing organ transplant in different areas, from heart transplant to lung transplant, especially following this COVID epidemic. This will serve to improve the awareness of an important entity in our country, and we have miles to go. And contrary to what we have seen several decades ago, the results of organ transplant have steadily improved over the last 2 decades, thanks to the sophisticated immunosuppression and better management of infectious disease. And like every other specialty, the mother of all organ transplant started with general surgery, with Alexis Carrel devising the vascular anastomosis, which led to the surfeit of organ transplant in different areas. And we'll first have Dr. Rohit Dama introduce the president of Surgical Society to take this forward.
Welcome. We know the president of the ASI, the Associations of Surgeons of India, is Dr. Abhay Dalvi. Just a few words about him. He is a senior surgeon with special interest in minimal access surgery, and currently he is a professor and in charge of the minimal access surgery department at Syed GS Medical College and the KEM Hospital in Mumbai. He's been devoted, I think, 36 years of his service at this institute, and currently he is the president of the ASI, which has more than 26,000 members and the biggest surgical body of surgeons in India. He was also the ex-president of the IAGS in 2015. He's held various executive positions in the boards of AMASI, the SAGES group, and also the ELSA group. He's been invited as faculty at various international and national conferences, especially to do with minimal access surgery. And he's also a reviewer for the SAGES meeting videos since the last 3 years. He's had 16 orations at both national and international levels, and he has about more than 50 publications. He has a huge experience in surgical cases, but special mention is about adrenalectomy. Is one of the highest numbers in India. He's done more than 400 adrenalectomies. So I'd like to invite Dr. Abhay Dalvi to give his talk about the organ donation.
Thank you and good afternoon. I bring you greetings from the headquarters of the Association of Surgeons of India on the occasion of the World Organ Donation Day. I thank and congratulate the Asian Institute of Gastroenterology, Hyderabad, for conceptualizing a wonderful program on this day, targeting particularly the need for awareness of organ donation. The world has galloped in advances, both technology and techniques, that have been instrumental in success of transplantations of various organs. The latest reported in Mumbai was the hand transplant in the first of its kind in a public hospital, absolutely done free of charge. Overall results in kidney and liver transplantation have plateaued with lesser morbidity and mortality. Other transplants like cardiac transplant, lung transplant, pancreas, and intestine are slowly taking shape. I know it takes time for a setting or a structure to develop and reach its pinnacle. For success of any transplantation, a multimodality approach with a sustained one is the key. While transplant teams have gained momentum, there is a severe lack of awareness and knowledge about the importance of organ donation in general population. It's not only India, even a country like USA, as per the statistics available on the net, organ donation seems to be dismally low. Reasons can be many. India has diverse culture, faith, religions, beliefs, and languages. And more, what is important is illiteracy. Greater efforts will be required to appraise the country that a departing soul can save multiple lives. These saved lives will be living ambassadors for organ donations, and so would be the living organ donors. We have today a galaxy of dedicated presidents of various national societies: the Nephrology, Indian Society of Gastroenterology, Cardiology, Chest Medicine, and HPV Surgery Indian section. Let us hear from them about awareness of organ donation in their respective fields. With a membership strength of 27,700 plus of the Association of Surgeons of India, we are all general surgeons. But whatever you think about, that the association can give in spreading knowledge in general population as well as the doctor community, we are all ready to help. I can promise you 100% with that help. I once again thank Professor Nageshwar Reddy, Chairman, and Dr. G.V. Rao, Director of the Asian Institute of Gastroenterology, as well as the present moderators for envisaging such a wonderful program. Thank you.
Thank you very much, Dr. Dalvi, for bringing up the important issues of challenges in a developing economy of organ transplantation. And we'll move on to the next session with specific organ donation and their challenges.
Thank you, Dr. Narasimham, and thank you, Rohit. Thank you, Abhay, for that nice message. Cardiac transplants have always been dramatic, both for public and for the science also. One of the earliest transplants to be done was the cardiac transplants, and since then, of course, there has been a lot of progress in this area. To discuss this and to take us through this, we have our moderators. Dr. Rakesh Reddy himself is an experienced cardiac transplant surgeon. He is the Director of Cardiothoracic Surgery at the AIG Hospital, and Dr. Rajiv Menon, who is the Head of Department and Director of the Cardiology Services at the AIG Hospitals. Rakesh and Rajiv.
Yeah, thank you so much, and good afternoon, everyone. I think it's indeed our pleasure and honor to have amongst us the President of CSI, the Cardiology Society of India, Dr. Mohanan. And at least in cardiology circles, there are very few people who don't know Dr. Mohanan. He's been one of the pioneers of cardiac research in this country, especially in the field of epidemiology. He has published at a time when most of the studies used to come from Western countries. He's presented in some of the most prestigious journals like Lancet, European Heart Journal, and he's most famous for the acute coronary syndrome Kerala study. And this included looking at how patients develop ACS, how to prevent, how to improve the hospital outcomes, so on and so forth. And that is just one of the few studies which he has conducted, and he's actually really made a significant difference in the field of research in our country. So over to Dr. Mohanan, and I'm sure you'll enlighten us about cardiac transplantation, what the situation is today in our country. Over to you.
Thank you, Dr. Reddy, Dr. Mohanan, for the kind words. With your permission, can I just share my screen?
Yes, please.
Hope it's hope it is visible.
Yeah.
Yes.
As Dr. Reddy was echoing, transplantation, whether it is in whatever field, it has not won over days or years, but it echoes the progress that has been made in the entire spectrum of medical sciences like medicine, surgery, pharmacology, infectious diseases, imaging, and much more. And of course, this is an excellent opportunity which Dr. Reddy and his team has designed to collaborate with the individual each one of our problems and trying to find out whether we can do anything better. So my job is to give you some perspective on that, on the cardiac transplantation. And over the years, you are asking me to finish my lecture in a minute. This will be the slide that I'm going to show you. But over the years, we have in 1960, when we have the first renal transplant by Dr. Bhalla. And then Christian Bernard came, and in 1964, we had the first cardiac transplant. Of course, he was when compared with the Norman Shumway, who has been considered as the father of cardiac transplantation. Shumway was the tortoise, and Bernard was the hare. But over the years, you can see that at one point of time in 1970s, the mortality, 1 year mortality, the survival, in fact, was just 17%. And look at where we are now. We have achieved 90% 1 year survival, and near the 70% nearly that applies to in our country also. And thanks to the fantastic developments in pharmacotherapy, immunology, and all that. So I was just mentioning about these two important gentlemen who initiated that. And if you look at our country, 68, Dr. Sen did the 6th cardiac transplant in the world. Of course, it was, if you look at the outcome, it was not so good. But then he did that on a backdrop of 100 canine model surgery, a feat unthinkable in today's time. But then possibly the first successful transplant was made by Professor Venugopal of the Institute. By the time we had the TOA coming into place, and of course, Dr. Cherian, and I cannot just forget the feats by Dr. Balakrishnan, who has single-handedly done possibly the maximum number of cardiac transplant in India. And now look at the figure. Now it's a very pleasing figure of the surgeons of. They're all cardiac surgeons. I'm not included any cardiologist picture here. These are the guys who is shouldering the primary responsibility. Now, the Delhi, and we have Kerala, we have Andhra Pradesh. You have the phenomenal amount of surgeons and centers doing cardiac surgery in India. And we have again, now at least 3 organizations which looks after the issues of transplantation. The SHFT, which has its origin in Kerala, then we have the thoracic organ transplantation in India, and finally we have the Indian counterpart of International Society for Heart Lung Transplant, which in fact came out with some guidelines during the terrible pandemic time. So we have progressed over the years, and if you are allowing me to show one of the latest statistics, this is compiled by the Secretary of the Cardiothoracic Surgeons, and he tells me that this is our figure of cardiac transplant over the years. Over the years, look at that. We have made sizable gems in these times, despite the all difficulties that we had, which I'm sure to come in a minute. Of course, this is that. No, our role model always is Spain, where the organ donation rate, look at the organ donation rates, 32 per million, and look at us. So this is an area where all of us now have combined. We has to do a lot and lots of work. And the awareness, at least in India, in our country, is pretty good. At least 67% think organ donation is important. But awareness of the process, the willingness. This is where possibly we may have to do some sort of a concerted effort and improve that particular part. And I'm sure with the lot of ideas from all of us, we can definitely do that. The concept of multi-organ donors over the years has definitely increased. Of course, this is the cardiac transplant. I am at the cardiac transplant is at the lowermost edge over the years. This is the renal, this is the cardiac. And so we have a lot of things to do. This is something which we should be trying to avoid. The wastage of the non-utilization of the, basically because of the paucity of a recipient list. We cardiologists manage, and of course the physicians manage heart failure. Unfortunately, many of the states, despite the very many organizations which coordinate the transplant scenario, I think we are also at fault. We don't keep a PACA recipient list and give it to the transplant surgeon. So what will be my thought process to increase now, a few things I just wanted to stress on. Try to augment the donor pool, increase the donor pool. Let's try to have, let us impress upon all the policy makers about the usefulness of a national database of committed donors. One of the idea has been to link the donor card with the Aadhaar card, at least for retrieval of the organization. The transportation has been a real nightmare. Even though we have, every state has the government allows you to have a green corridor. At this point of time, I should also say about the Hyderabad's metro green corridor, maybe for some sort of a record there. But then transportation has been a real nightmare, and we should find out ways to augment the organ transportation facilities. We should have a more efficient interstate allocation. We have no dearth of organization for that. And early alerting the harvesting team. See, and if you give about 12 hours for the harvesting team and alert them about the possibility of a donor, then that will make the life easy for the recipient. You can reduce the ischemic time and you can better the outcome. It's time also that to have a national network for airlifting these vital organs. I mean, we have this, as I was mentioning, we don't have a dearth of organization networks. We have the NATO or the national coordinating agencies, but I will definitely want more muscles, more teeth for the NATO, and even they have come out with a registry auto, but then I definitely will like to have we don't have a PACA registry, and we are all very much impressed by what a registry can do, not only to mitigate the disease, but to improve the services for each one of us. So registries can do fantastic things. I was just mentioning about some of these coordinating agencies but then this is confined to few states. I will want each state. You have seen the picture of the smiling surgeons from each of the states. Let us have more number of agents, coordinating agents from these agencies. I mean, from these each one of the states, and we possibly lack a PACA pyramid. We should have a transplant program pyramid, and we should have definitely it requires better controlling, better supervising. And that is the only way that we can improve. The concept of the brain depth to the circulation tapping down is, I mean, now the America and Australia has done has taken the concept of DCD donors. India is yet to get that. Again, when it comes to the hepatitis C positive donors, we need the policy decisions. We also will definitely need a lot of improvements in gene editing, in immunosuppression, and one of the rejection is still, I'm not forgetting infection, but it has been one of the real bane of transplant. And these newer immunological methods to identify, to target these diseases, again addressing CAB, which is again one of the real bane of the cardiac transplant, is absolutely a must, and we should all work together. And this is my last slide. Just by quoting Christian Bernard, it's infinitely better to transplant a heart than to bury it to be removed by God. Not forgetting the quote from Eric Swain. All of this is only made possible by the courage and the generosity of the patients and their families who choose to give the gift of life in the face of grief and tragedy. Thank you for your kind attention.
Thank you very much, Dr. Mohanan, for sparing your valuable time to participate in the AIG Hospital Public Awareness Drive for organ donation. The message you have given today is very loud and clear. There is a gross imbalance in demand-supply ratio for organs in our country. I sincerely hope and pray that the message you delivered today will enlighten many in the society and will encourage people to come forward and pledge their organs for the needy. Thank you very much once again.
Thank you, Sukesh. Thank you, Rajiv. I think I'd like to thank Mohanan especially for that fantastic talk. This is one of the most interesting talks that I've heard on transplantation, and is given extremely wide coverage of what is happening not only in the field of cardiology but in transplantation in general. And as he rightly mentioned, the concept of NOTO is becoming more important. The National Organ and Tissue Transplantation Organization is now spreading its wings to not only help transplantation in our country, but to get the stakeholders together to create awareness about this. And I think this is a very important thing that Mohanan has mentioned. And I think under the leadership of Dr. Mohanan, probably with the Cardiology Society behind them, our cardiac transplants would increase to a large number. And as you very rightly put it, it's better to transplant it into another human being rather than to be eaten by worms. Thank you very much, Mohan, for that fantastic message. We now have our next team, and I think in recent years, lung transplant has become extremely aware, and with the COVID-19 coming up, I think lung transplant has in fact come into fashion because of not only more availability of organs, but the capacity to transport these organs because of better air travel and so on. The availability of ECMO in many hospitals now, lung transplantation has become more than reality. And to discuss this, we have with us Dr. Vamsi, who is actually the director of our pulmonology medicine at AIG, and Dr. Naresh Kumar, the senior consultant cardiothoracic surgery, AIG Hospitals. Dr. Vishwanath.
Good afternoon, sir. It's my pleasure and privilege to introduce my beloved teacher, Dr. Digambar Behera, who is currently the president of Indian Chest Society. Dr. Digambar Behera has been like very instrumental in the and a very well-known name in the field of pulmonary medicine, both in the country as well as in the international circles. He has contributed immensely to the field of respiratory medicine, and in recognition to his contribution to the field of respiratory medicine, he has been awarded with prestigious Padma Shri Award. His journey has been interesting. He has been associated with PGI Chandigarh since 1978. He joined the institute as a junior resident. Then he went on to become a professor of the pulmonary medicine, head of the department of pulmonary medicine, and then he went on to become the director of PGI Chandigarh. Not only in PGI Chandigarh, he has played several key roles in outside the institute. He was the director of National Institute of Tuberculosis and Respiratory Diseases, and also he's the president of Indian Society of Study of Lung Cancer. He has been very active in the field of tuberculosis and lung cancer and has contributed immensely. And he has been in the editorial board of various national and international journals. Needless to say, he has got numerous publications to his credit. Sir, it's our pleasure to welcome you on this World Organ Awareness Day to give an awareness talk, sir.
Okay, thank you. Thank you for the nice introduction. I am very thankful to Dr. Reddy and Dr. Rao for giving this opportunity to share my views on behalf of the Indian Chest Society about the current perspectives on lung transplantation in India. You know, lung transplantation is the definitive treatment for select progressive end-stage lung disease patients, despite being an optimum medical therapy. You know, although this has picked up in a big way in Western countries like USA, Canada, and other European countries, Asian countries like China, Japan, and India have started this program despite various odds and challenges, some of which I am going to discuss. However, some of these challenges seem to be unique to the developing countries like ours. You know, the lung transplantation in humans was first attempted by James Hardy in 1963. And in 1983, Joel Cooper from the Toronto group reported the first successful single lung transplant in humans. Then, since then, it has come a long way worldwide, overcoming the medical challenges of rejections, infections, anatomic wound healing, then immune suppression, and non-medical challenges like organ donation, which you heard in greater detail, its awareness and its various issues, and of course the cost, which is one of the important issues for countries like ours. If I just, this is the adult lung transplants. This is the number of transplants by year and procedure type. You can see the things in pink, that is the bilateral or the double lung transplant, as that is gaining the more and more favor in comparison to the single transplant, and this is over the years. And this is the data that is reported to the International Society for Heart and Lung Transplant, and that is up to 2019. You see the data collection is around over 63,500 lung transplants in adults, and the most common indication is the COPD, followed by interstitial idiopathic or the what we call as the idiopathic pneumonias, then cystic fibrosis, then ILDs were not idiopathic, and then alpha-1 antitrypsin deficiency, retransplants, then pulmonary artery hypertension, idiopathic type, then a non-cystic fibrosis, bronchiectasis. You can see a large variety of indications for lung transplant. Again, as you see over the years, that is shown in green, it was COPD, used to be the commonest form, but as you can see in the blue, you see now the interstitial lung diseases, they are now the common indications for lung transplant. Then as regards the survival by procedure type, you see obviously double lung transplant have got a better survival of about median survival of about 7.8 years, and a single lung transplant about 4.8 years. You see, this is then depending upon the disease for which the transplant is done. So it is stopped by cystic fibrosis, and then followed by alpha-1 antitrypsin deficiency, and then pulmonary artery hypertension, and then the ILD is not idiopathic type, which is about 6.7 years, and the COPD about 6 years. This is, this is roughly, if you see, this is the time post-transplantation per year. This is the survival percentage. You can see for 1 year, it is about 80%. 3 year about 65% and 5 years about 54%. This is, not only confined to the adults, there are also pediatric lung transplantation that being carried out in the centers. Of course, here the indication is slightly changed. As we know, the disease pattern in a chronic lung disease pattern in pediatric group is different. So cystic fibrosis is the commonest indication, and followed by other chronic lung diseases in a case of children. Now coming to the scope of lung transplant in the country, I mean, what is there a need? So I'll just like to tell you, this is the burden of chronic respiratory disease and their study across India. So this is from the global burden of disease study. As you can see, COPD, which I told you is one of the important indicators, or is one of the conditions where lung transplant is usually required at towards the end. You can see the burden of COPD in 1990. It was about 28.1 million cases, and then in 2016, about a decade later, you see how it has jumped to about 55.3 million. So that means the COPD, that is what is the burden of COPD in this country. Similarly, about the interstitial lung diseases, earlier if you see way back in the late 70s, you can see these are only case series of 100 cases, 60 cases, 61 cases. So our group first reported the ILD from Chandigarh, PGI Chandigarh, 61 cases, and then these you can just see, count them. That means the disease was so rare. But now the disease is very, very common. It is seen very commonly. And again, the ILD India registry that was again initiated by the Indian Chest Society. It was from 27 centers. And over a period of 3 years, this is the report of more than 1,000 cases. But I think what is more important, it is the study of epidemiology of ILDs in India. You see that this is again from the PGI group where actually I was working. I am part of this study. You see, so on the basis of, so here it is on the basis of 2005 cases between March 2015 and February 2020. You see from the data from the Tri-City of Chandigarh, Panchkula, Mahalli, which includes 570 cases in the study. So we try to estimate the crude incidence and the crude prevalence. What I am trying to say, the all interstitial lung diseases in India, it is estimated that the crude incidence will be between 92 to 185,000 cases, and the crude prevalence will be between 0.45 to 0.89 million cases of interstitial lung disease. And the sarcoidosis, idiopathic pulmonary fibrosis, and then connective tissue disease related ILD and hypersensitivity pneumonitis. So these are the ways we are going to see the burden, or that is what is the burden in India. Then this is again another study, the EMBARK study about the bronchiectasis, which is another condition where lung transplant is required. You can see we have got the data. So it is again, so these three conditions, as I told you, they require lung transplantation at some stage, towards the end stage. So what I am trying to see, there is a need of some of these patients will be requiring lung transplant. Now coming to the lung transplants in India, the first successful heart lung transplant, already you have my previous speaker had told that in India was performed in Chennai, and then the initial experience was encouraging, paving a way for the new era of thoracic organ transplantation in India. And since then, few centers in India have tried to establish lung transplant. Actually, unfortunately, somehow I think we have seen the lung transplant is by and large, as you will see subsequent slides, is confined to the centers in the southern part of the country. The northern part is way behind. The Delhi is picking up, as you can see. You see, this is Dr. Cherian, who did the first heart lung transplant in India. Then Dr. Girinath, who did the first heart transplant at Apollo. And obviously the Dr. P. Venugopal, he performed the first heart transplant in India. This is the experience of the Apollo Hospitals, Chennai. So this was reported in 2018. they had 101 lung and 62 heart transplants. So, this out of that, 25 double lung transplants, 7 single lung transplants. And then they have reported that 73% of the lung transplant patients, they are doing well, and 80% survival in the primary pulmonary hypertension and 67% survival in the ILD group. Then the other group, like the global group, I'll show their data. The other sides, they do frequent lung transplants in India, and then the Kochhar, Dhirubhai Ambani group of hospitals are also doing. This is the group. I think you can see in many of them, you can know that how it is the Apollo group, and then this is the group along with the patients. Some of the can identify some of the the 4 of these, they are long-term survivors after combined heart lung transplant. And this is these are the 4 years post-transplant under general anesthesia. And then I think this is one of the reports which has been published in our journal, that is Lung India. This is the experience of Institute of Heart and Lung Transplant, that is the Krishna Institute of Medical Sciences from Hyderabad, Telangana, India group. They started their thoracic organ transplant program in February 2017 in Chennai, and subsequently the program was expanded to Bangalore, Mumbai and Hyderabad. And since the inception of the program, they have done, you can see 140 lung transplants, then heart transplants and other until October 2020. And this is the group has published in the just last month in Lung India. You can see it's a data of 132. This is a retrospective analysis from their data available at the 3 centers of the Institute of Heart and Lung Transplant, the global hospitals across Chennai, Bengaluru and Mumbai. You can see the most common indication is the interstitial lung disease, and even obviously these are the subtypes of interstitial lung disease. And here you can see the survival function. You can see this is a very good survival data, about 80% by by 1 year, and then even the survival is much better at 30 months and 36 months, etc. Then obviously then something was told about the lung transplant in COVID-19 patients. Unfortunately, we do not have a data, but I think I came across a publication in the Lancet Respiratory Medicine only that came in February. Then this was a multi-institutional case series from the world that included one case from Chennai, from India, and then 12 patients with COVID-19 associated ARDS. They underwent bilateral lung transplant, and then there was one recipient from India, as I told you. Then there are, of course, no scientific publication, but as you can see from the media, I have just quoted some of them. Mark Hospital conducted Delhi's first lung transplant. Then Jharkhand minister recovers after double lung transplant in Chennai. Doctors perform rare double lung transplant on COVID patients. Then transplant in Delhi. And then the Telangana COVID-19 triggers spike in demand. So, many, I think that is what is the talk, but actually I could not get in scientific publication because maybe these are recent things and subsequently we get that. These are all in the private sector. Actually, while I was working in PGI, actually my group from PGI, we tried to start the lung transplant program in the, public sector in a hospital. So this is our first experience of the first lung transplantation performed in the public sector in India. And that is, you can see this is a case of advanced interstitial lung disease. We could do it. And of course, it is a long struggle. I was heading the department and I was there in service with PGI. And I think that is a very, very learning experience. And then maybe if time permits, I'll share some of them. So then obviously AIMS is trying to do, this was only a news, it was published, but I don't think AIMS people have even started. So you see if you see about the comparison of Delhi, India, in comparison to other countries like USA, Australia, European countries, etc., you see we are far behind, and this is the data for 2018, and I'm sure it will be the same this year also. So now then question is, what are the issues of lung transplantation in India? The issue is I think first thing is the donor availability, and that my previous speaker has already deliberated about everything. Then the other issues are the late referrals, the reluctance of physicians to refer cases due to lack of confidence in surgical outcomes, then ventilator-associated pneumonias or the infections, graft dehiscence, then the infection that include bacterial, fungal, viral, and mycobacterial. So then there are issues both in the recipient and on the donors, like the logistic issues, cost and organizational issues. Then, this is a full-time job, and then, as I was telling you in PGI, it was the whole department, the cardiothoracic team, the anesthesia team, the critical care team, everybody. So that needs a dedicated team. Maybe it is very difficult. So actually we are not, since then, we are not able to venture to go for the second one, although we maintain a directory. Then selection of the lung for the lung transplant and the correct recipient is crucial for a successful lung transplant. Then consensus document is of course available for both the donor and the recipient. So the national apathy associated with these diseases also exists, as the treatment options are resource consuming, limited and expensive, social and religious beliefs and taboos, then absence of a decision-making process in the bereaved family, multicultural, racial, religious beliefs, and diverse traditions in many centuries, reluctance in organ donation. In some parts of the country, which I think you have already heard, we have got obviously the Transplant, and in the particularly in Tamil Nadu, the Zonal Transplant Coordination Center, Mumbai, Pune, Jivandan, you see in Telangana. And obviously, I think Dr. Reddy also told about the Noto, the Roto, Soto, and the city level, like the zonal levels. I think these are the much advances which have taken place in this country, and we should take advantage of that. And organ donation and transplant are still at an early stage in India, particularly lung transplant. The challenge for the success of an organ transplant program is to build up greater trust in the process of organ donation and allocation, considering that each donor can save up to 8 lives. And you can see that is again, my previous speaker had told that in 2019, the organ donation rate in India was lowly 0.52 per million population compared with 36 per million in USA. So the sensitization of doctors regarding brainstem death declaration, this is also another issue. So then obviously there are definite indications, so I am not going to about that. So what are the proposed solutions? Actually, this is a very nice article. I think I'll request everybody to go through that, which a Tower 100 group has made a very, I think, updated. It came out in May 2021 only, just recently published in the Indian Journal of Thoracic and Cardiovascular Surgery. So they have told about the issues very nicely, and I have copied those slides, the proposed solutions at the donor level, and which I think already told, managing the donor with a multidisciplinary approach, improving the quality of organ, then community sensitization, novel concepts to expand the donor pool, and the mandatory declaration of brainstem death by every hospital. Similarly, the solution for recipient level, the physician awareness for early referral, community. Actually, we wait. I have seen many of our pulmonary physicians, they wait till the end. At that time, the patient may not be fit enough. Then the community sensitization to lung transplant, robust pulmonary rehabilitation programs, then continuity of care partnership with the community referring physicians, and establishing a long allocation score. And I think a networking is also very, very essential. Say for example, even if we have got facility in the South India, some patient from North India, even if he gets it, then getting or following up that. So therefore, the physicians in North India or the people concerned with that, also they need to be trained. This slide you have already shown. Again, the cardiology, of course, was not the lowest. In fact, the lung deceased organ donation for the lung, actually it is the lowest, right? And then, so these are the outcomes that I have already shown you one of the slides.
So this is the from that slide I had already shown you. So there are of course some post-transplant challenges, as I was telling you, primary graft dysfunction, then the team building, organ donation network, cost of lung transplant is another issue for countries like ours, and then obviously the novel COVID-19 challenges. The good thing about this slide, I have tried to look the Indian literature on lung transplant. You can see it is good that about I think last year I was to speak something on that. It was very difficult to get a literature, but I think when I tried for this time, I could see there are very good, nice Indian references about the lung transplant. And then, so what is the future of lung transplant in India? So the challenge of lung transplant in developing countries like India are not unsurmountable. Proper coordination between various stakeholders and creating awareness in society about lung transplant and organ donation, building a team of dedicated and passionate individuals, early referrals to transplant clinics where it can be given, then better donor management, and ushering in an exciting future for lung transplant program in India. So, ladies and gentlemen, the message from Indian Chest Society as the president of ICS will be that lung transplant is the definitive treatment for certain progressive end-stage lung diseases. However, the overall organ donation rate in our country is quite low at around, I have already given you the figure, 0.52 per million. It is almost, the other countries when it is 70 to 80 times more common. So we need to sensitize the general public as well as doctors on benefits of organ transplant to achieve improvement in numbers. Cost factor also acts like a deterrent, especially with lung transplant. We need insurance schemes and other innovative ideas to cover such expenses for more people to consider the transplant option. So thank you very much for your kind attention.
Regarding the lung transplantation in India, percentage are equivalent for lung transplant are almost 20,000 per year, but we are not able to meet that because of lack of awareness. In spite of so much advances in India, we have only 0.5% per million population compared to other countries where it's up to 40 per million population. So I hope the message is very clear and reach the public. So more and more organ donations will happen in India so that the organ transplantation program will run successfully.
Thank you, Dr. Vishnath, and thank you, Naresh, and thank you, Dr. Behera, for that very comprehensive talk on the current situation of lung transplant in India and the potential challenges that are going to come up. The next set of talks are going to be on organ which is very dear to me, the liver transplantation, the current situation. And this is going to be a unique session because we have two presidents talking. The president of the Liver Society, or so-called Indian National Association of Study of Liver, Dr. P.N. Rao, who also is the head of the department of the hepatology at AIG Hospitals, and Dr. Rakesh Kochhar, who is the president of Indian Society of Gastroenterology. Kochhar, of course, will be introduced later by Dr. Balachandran. The session will be moderated by Dr. Balachandran Menon, who is one of India's top leading liver transplant surgeon. He is also the head of the department of liver transplant surgery at the AIG Hospitals. Dr. Bhalla.
Thank you, sir. It's my pleasure to introduce Dr. Kochhar. He is one of those privileged physicians who started their career right from MBBS onwards from PGI Chandigarh. After MBBS, he went on to do MD and DM from the same institute and has worked in the same place till retirement. And Dr.
Yeah, can you hear me?
Yes.
Oh, yes, please go ahead.
Thank you, Mr. Chairman. And I must compliment and give credit to AIG team for organizing this function on the occasion of World Organ Transplantation Day. This is, I believe, an awareness program and bring everyone on board for this important issue which governs all of us and affects all of us. Now we have two transplants for the gastroenterologist. One is the liver transplantation and the other is intestinal transplant. While liver transplantation has picked up a large way, in a huge way in the last about 22 years, intestinal transplant has still remained in infancy. The first liver transplant was attempted in India in 1995, much beyond what the Western world had started with. But the first intestinal transplant took place only in 2013, just 7 years ago, and there have been just over 10 to 15 intestinal transplants in the whole country. While liver transplant, we have more than 30 centers as of 2016, and even patients from neighboring countries come to India for liver transplantation. The success rate is pretty good, but most of the transplants are still being done in private sector. They are very little being done in government sector. PGI is one such center, but with just a less than a score of transplants being done in the last 7-8 years. Overall, we need many more centers, and I believe that only a small percentage of patients who require liver transplant actually get it. Less than 2 programs will go a long way in generating awareness about transplantation in general among all the physicians, surgeons, and the nation, who primarily the donors come from the public. On behalf of Indian Society of Gastroenterology, I would like to compliment the team and hope that this goes a long way in generating awareness about the organ transplantation. Thank you.
Dr. P.N. Rao.
Thank you, Dr. Kochhar. Thank you very much.
It's my privilege to again introduce Dr. P.N. Rao. He is the president of INASL, and he has had a pretty long innings. He also started his career from PGI Chandigarh. Initially, after his DM gastroenterology, he worked in PGI Chandigarh, and from there he moved on to NIMS. He started the Department of Gastroenterology in NIMS, which is one of the very prominent departments in India. And in 2006, after retirement, he moved to AIG and has been here for the last 15 years. He has been instrumental in a lot of publications, a very devoted and very expert physician. It's been my privilege to be working with him for the last 1 year.
Thank you, Dr. Bhalla. Can I share my slides, please? Well then, it's been my proud privilege to be associated with the Indian National Association for the Study of the Liver Diseases, which is 28 years of organization. Incidentally, we had our recently, last week only, we had the 28th annual conference, wherein we shared with the recently formed LTSI, that is Liver Transplant Society of India, we have discussed extensively about the liver transplantation. And for the people, I believe that some of the non-medical people also are viewing this, and for those people, for the advantage for them to know, these two terms are very important when it comes to liver transplantation. That is the diseased liver transplant, that is called DDLT, and the living donor, so LDLT, where the deceased donor, after the brain dead person's liver is taken out and then put it into the recipient, and the living donor is the one where a portion of the liver is taken and then it is put into the...
Can somebody make the audio? The audio is not very clear, sir.
Increase the audio.
It's audible now?
Getty.
Is it audible?
Yeah. Yes.
Okay. Right then, of course, when it comes to the organ transplantation, we should be familiar with some of these terms, although some of the things have already been introduced. National Organ Transplant Program, under which we have got NOTO, ROTO, SOTO, that is at the national level and the regional level and the state level. And we should know who has to, for all practical purposes, most of the liver diseases will end up in the liver transplant. But our aim is not to do the liver transplant, our aim is to prevent the liver transplant. How can we do it? And the two important things which are staring at you here, that is the alcoholic liver disease and the non-alcoholic steatohepatitis, that's the non-alcoholic liver disease, and also for hepatocellular carcinoma, there's an increasing demand for the liver transplantation. Many of my patients who come to me, they tell me that I don't take alcohol, I don't have a viral disease. How is it I got the, in fact, even hepatocellular carcinoma also, and the liver disease? I tell them that you have been obese, and also obesity is associated with diabetes, and therefore the people, many few people will know that those people who do not take alcohol also can get a liver disease, and particularly who are obese. And Indian standards for the obesity are slightly different. Western standards above 24 of a BMI is obesity, whereas our BMI above obesity is more than 25 is our obesity, where the Western standards is more than 30. And again, I must remind you that our waistline should be less than 90 for a male and less than 80 centimeters for a female, which is much less as compared to the Western view. Suppose if you ask me how to prevent a liver transplant, please be vaccinated for hepatitis B, adults. Nowadays, we know that the National Immunization Program involves the hepatitis B. And if somebody is detected to be hepatitis C, we have got an excellent drugs for that, for the cure of hepatitis C. And don't be obese. If you're obese, reduce your weight. If you're not obese, don't put on your weight. And know the alcohol limits, know what is hazardous drinking, and very good management for the diabetes. And these are the things which will go in a long way to prevent a liver disease and also a hepatocellular carcinoma. And we know that our situation of a shortage of the organs is being released by the Directorate General 2016, and for every organ there is a shortage, and much also for the liver disease. We are doing it only about 1500 now. It's of course gradually increasing, whereas the demand is much more than what is. Unfortunately, we don't have any banks, like a cornea bank here, and therefore the organ has to be immediately be put into the recipient. And there are some of the issues are there about this kind of a thing. Lack of awareness, we thought so, but it's not really lack of awareness. If you see on the right side, awareness is there among the people, awareness has been raised, but ultimately who agree is only 3% of them. And because we don't have a bank, there is a transport problem is there. And fortunately, many of the governments, they have been giving us a green corridor for the organ to be transported. And there is a great need for educating the people about the necessity of the organ donation. And it's been doing an excellently. Tamil Nadu has actually shown the way. And you can see on the top that they achieved a Guinness of Records for accumulating awareness for the largest number of the people in one go. And this has been followed by Andhra Pradesh, the erstwhile AP, undivided, then Telangana, the Andhra Pradesh. On the right hand side, you can see Kerala is catching up again. In the last 4 years, 2012, everything was zero. The one on the left hand side. On the right hand side, you can see the amount of the transplant which have been done here. And also the Mohan organization has been an NGO which is, and then the right side bottom, you can see that the ZCCC, that is Mumbai, Maharashtra is also not behind, and Karnataka also is also been. So in fact, all the state governments are all catching up, and also not only that, they are competing with each other, that how to go. And then in fact, it's been told that Maharashtra has taken over the Tamil Nadu recently about the various organ transplant. That should be the spirit with which all the other states, although these things are also there in the northern states, I am just mentioning which are there in the southern states. And these are the celebrities who have pledged their donated organs. And I must say that my message is that organ donation is a movement. It never stops. It's an institution and it's a need. Let us all support it. And thank you very much for your attention. Thank you, Dr. Bhalla.
Thank you.
Can I have my slides, please?
Now I would request Dr. Bhalla to just go into a little bit more details about some technicalities in liver transplantation.
Liver transplant has been is a very established procedure. Right from 2005 onwards, the numbers have been picking up, and now we are almost touching 2000 a year. That is just before Corona. In 2018, there were about 1,900 liver transplants. It's been seen that nearly 500,000 patients in India die because of lack of organs, and the donation is very less. It's actually 0.8 per million, and it is significantly less compared to the leader Spain, which is 47. Even in UK, it is about 37 donations per million. But on the other hand, we have the second largest number of transplants being done world over. These are some statistics released by Orbo from AIMS. The need for kidney transplant is about 2 lakhs per year, and roughly 8,000 are being done. Liver, by a very conservative estimate, is about 50,000, and almost 1,800 per year is being done. Cardiac requirement is about 15,000, and roughly it has touched 190. And 60,000 corneas are being collected every year. It's been noted that there are about 80,000 road traffic accidents, and 50% of such deaths are due to brain death. Even if we are able to actually convert even a fraction of these patients, that should be enough, and most of the living donors may not be actually required. These are some NOTO statistics over a period of 5 years. You can see that total number of transplants had been nearly 50,000, out of which 40,000 were living donor, and deceased donor were about 10,000. If you look at the liver, the deceased donor numbers have been increasing. It's about nearly 3,000, and there has been about 6,500 living donor liver transplants. Now, as of now, there are about 170 centers in India which have done liver transplant. But if you look at the major centers, most of the major centers are actually, most of the bigger centers, most of the bigger programs slowly converting on to minimal invasive surgeries, minimal donor surgeries. I expect the living donor pool also to increase significantly. This is actually from the NOTO site, and it is for public, it's on the public domain. You can see here that the number of transplants have been gradually increasing over the years. These numbers may not be accurate because most of the center, a good lot of centers are actually not entered their data into this. You can see in 2018, these figures are correct. There have been 7,936 kidney transplants, 1,945 liver transplants, 241 heart and 191 lung transplants in 2018. In 2019 and 2020, because of corona, the numbers have dropped. Now they have again started picking up. You can see here that males have significantly donated more organs compared to the females, and the cadaveric transplants have been much less in number as compared to the living donor transplants. It's been seen that present donation rate is about 0.8, but if we can push it to 1, which it may not be very difficult, it needs a little more of public awareness. With this, the requirement of most of the livers, heart and lungs in the country can be taken care of, and to a good extent the kidney shortage can be covered. If we are able to reach the figure of 3 to 4 per million, there will be no necessity for even living donor kidney donations. If you look at the states, some states like Kerala, Tamil Nadu, Telangana, their donations are to the tune of 4 to 5 per million, and slowly the donations have been picking up all over India, especially in the northeast. And we all hope that with more public awareness, maybe we will be able to actually achieve good, excellent numbers in cadaveric donations as well.
Thank you, PN. Thank you, Bhalla. Thank you, Rakesh, for enlightening us about the liver transplant situation in India, which is picking up very encouraging results that we see here. Thank you very much. On this World Organ Donation Day, I'd like to remind all our viewers that in fact one of the first transplantations were done by an Indian surgeon, Shushruta, almost 2,500 years back, when he was the one who actually transplanted nose transplantation, as it was famously reported. So I think this is a very significant milestone in the history of transplantation, which has gone a little unnoticed. But the organ which is transplanted the most, not only in our country but all over the world, is of course the kidneys. Partly because there are two kidneys that we have, and one of it can be easily donated. To discuss the kidney transplant situation in our country and all over the world, today we have with us Dr. Sairam, who heads the unit of nephrology at the AIG Hospital, and Dr. Bipin, who heads the urology department. Sairam.
Thanks, Chairman. So let me take pride in introducing Dr. Bhalla, who is an alumni of PGI Chandigarh. As I myself have trained as an MD and DM nephrology from PGI, it's a great honor to have Dr. Bhalla on the speaker forum today. Dr. Bhalla has not been a simple physician for us, but he is a phenomenal teacher and an intellectually astounding individual who has won the BC Roy National Award for the best of his teaching skills, as well as Padma Shri in 2010. He has done a pioneering work in peritoneal dialysis after getting trained in Singapore, and his publications span across the transplantations to peritoneal dialysis to interventional nephrology. And he is a wonderful speaker. I remember myself before leaving for the United States, attending several of his talks in India as well as abroad. And he's a pleasant and personable person to speak to. And without much ado, let me pass on to Dr. Bhalla for his brief message on the Organ Transplant Day. Over to you, Dr. Bhalla.
Thank you, sir. Let me share my slide. Are my slides visible?
Yeah.
Okay. Thank you, Dr. Reddy and Dr. Bipin. At the outset, I would like to congratulate Professor Nareshwar Reddy for arranging this webinar, virtual meet, on this World Organ Donation Day. And I also congratulate him for the excellent institute which he have made in Hyderabad, which is now not only in Asia, but it is famous all over the world. Now, coming to World Organ Donation Day, the purpose of celebrating these days is that if we want to have more of awareness campaign among the general population. And with that motive in mind, in fact, my thought is going to be more for the general public. As we all know, the organ donation is a process by which a person allows his or her organ to be removed and transported to another person in a legal manner. It is very important that this organ donation has to be a legal process, because there are a lot of stigmas involved, and that too in India and Asian countries and all over the world. This is very infamous that in India there is commercial activities going on. So with that, all things stopped actually to significant extent once Human Organ Transplant Act came in 1994. So this is definitely with the permission of the donor, and plus there is an authorization committee and appropriate committee which monitors that. And this can be a live donation, or it can be a brain dead donation with the consent of family members. So as already highlighted, that every year about 5 to 6 lakhs of patients die in India due to shortage of various or unavailability of various organs. The organ donation rate in a Western country is much higher as compared to India. And about 2 to 2.5 lakhs new patients of end-stage renal disease are added every year in India. This point already has been highlighted by previous speakers. And there are only 1,500 nephrologists and about 250 kidney transplant surgeons. And these surgeons are also not exclusive kidney transplant surgeons. They in fact do urology and general surgery. And in addition, they do kidney transplant work. So all these centers are actually in metro cities only, or maybe 6 to 8 cities in the country, and not available in the tier 2 or tier 3 cities. Only about 10,000 kidney transplants are done in a year, although NOTO doesn't give the actual figure, and unfortunately till today we do not have a proper registry where we can get the exact data of every transplant has to be entered in that registry. It is not so. That happens in US. And about 50,000 patients are on maintenance hemodialysis and about 8,000 patients are on peritoneal dialysis. So you can just see that it is only hardly less than 70,000 patients actually in total who are being taken care of, and rest of the patients are left to die actually, and they are continued on conservative treatment till death. So that is a very unfortunate situation in our country. And nearly 1 million people are on waiting list for a kidney transplant, and many more people kidney than for all the other organs combined. Unfortunately, the number of people waiting for kidneys is much larger than the number of available kidneys from living as well as diseased donors. And in India, the cadaver donation is actually less than 5% of total donations. The only good part about the kidney disease is that we still have a support system where can support the patient on maintenance hemodialysis or peritoneal dialysis till he gets a kidney either from the living donor or diseased donor. That's why the waiting list continues to swell in kidney transplants. But that is not so in liver transplant or in heart transplant, because there are not very good support system available in liver transplant. Although a lot of research and scientific developments are going on, but still we do not have a proper support system for liver and heart. Even for lung diseases also, we have seen in COVID era how difficult it was to manage these patients on ventilatory support. So the message to the general population is that you can save a life by being a kidney donor. So who can be a living donor, kidney donor? Usually patient person has to be adult and major. So we take 18 years to 70 years. Upper age we usually accept for kidneys up to 70 years. And we all know that God has given us two healthy kidneys, and you can easily donate one kidney, and even it doesn't compromise much of your kidney function. So that is the most important part about the kidney disease, that one can easily spare. Both you patient as well as the recipient can continue with one kidney, and they can lead a healthy life. Now, what are the various types of donation? You can donate to your close relatives as per law, your family members, brother, sister, children, parents, and even now with amendments, they have included now grandparents as well as grandchildren. So they can also donate by as per law. Now, unrelated means actually emotionally related, right? Cousins, then buas, aunties. That means actually related within the family, but not first degree relations. They can also be accepted as donor. Then we have pair donation, where we have a group and B group recipient and donor pair, and on the another hand we have a B group. So the A can exchange with A and B can exchange with B, and that's how the pair donation is allowed by law. The spouse donation is very much allowed, husband to wife or wife to husband. Although in our country there is a clear-cut gender bias, and more of the donors are actually females, starting from the first donor to offer his mother, followed by wife, and then after that we have the sister. And even daughters also, even unmarried daughters are willing to donate for their parents. So that is a very sad part, that there is a clear cut of gender bias, and already at international level, this point is being discussed that in Asian countries, especially in India, it is the donor, always the female, who is accepted as a donor. Now, since last about 10 to 12 years, we have started doing ABO incompatible transplants. The results are almost comparable to ABO compatible transplants. So this is again almost 1/3 of the donors were rejected because of ABO incompatibility. So now we have a much wider donor pool, and easily with desensitization process, use of rituximab, plasma exchange, and we achieve the desirable titers. And we are doing regularly in our center at AIG Hospital is the largest center which have performed ABO incompatible transplants so far in India. Then we have domino transplants, whereas depending on the better HLA matching, one patient donor, then one donor offers to one patient, then another offers to a third patient, then third to fourth patient. This is a chain of recipients and chain of donors. That's how simultaneously 3, 4, or 5, up to 5 or 6 domino transplants have been done in India. And a major center doing this is actually one of the center is IKDC Ahmedabad, which have done a large number of paired donation and domino transplants. Then, if who can be the donor? If both kidneys are as far as the cadaver donation is concerned, you can save 2 lives after donating both of your kidneys, and these kidneys and then can be potentially used for 2 kidney transplants. But because you can live a healthy life with just 1 kidney, it is possible to donate 1 kidney as a living donor, as I said earlier. And there are a lot of patients who are waiting for, so we encourage everyone to be a donor for the following reasons. Why? Because kidney will be only transplanted if he is healthy and suitable for the person who needs a transplant. And all the major religious faiths support kidney donation. There is no religion which says that don't donate organs. And there are very few health related restrictions, and most people can donate. And another thing is that one advantage of this is that one is that you have such a feel good factor that you have saved the life of somebody else, and that should give the donor a lot of satisfaction. Second is that you also get a total body checkup. So invariably you can, if you have hypertension, diabetes, or any other disease, and that screening part is done when you are being evaluated for a donor. Now, kidney transplantation actually is the treatment of choice for a patient who has end-stage renal disease. In India, just to give you the short work very hard, NATO has been established institution as an institution, but as far as cadaver donation is concerned, there is not much activity. So every major center has to have a counselor and a psychologist in ICU who should discuss with these families who are having brain dead relatives, so that they can be motivated for cadaver donation. This is just to show that how the native kidneys are usually not removed unless there are some definite indications, and the transplant kidney is usually implanted in the right iliac fossa, and the vessels are united with the lower limb arteries, and the ureter is united with the bladder. That is just to show, to have a visual picture of how the transplant is done routinely. Similarly, if you can have, some patients can get this transplant kidney is damaged, and then you can have a second transplant that can be put on the other side. Even now we have done sometimes 5 or even 5 transplants have been done in a patient. We can put another kidney higher up without removing this transplanted kidney. Now, source of the kidney, as I said, can be disease donor or cadaver donation. That is from the brain dead donor, or a donation after cardiac death. That is again a donation after cardiac death. Again, is not picked up in our country so far. Again, the reasons are that we have to be very active in especially coronary care units. Then living donation, as I said, can be from living donor, or it can be from altruistic or emotionally related donor. Then the most important thing is that if you want to really do service to the society, everyone should sign the organ donor card. And this organ donor card, again, at least in North India, I know that it is not picking up. And most of the places, even if somebody comes to us that he wants to sign a card, we don't have a donor card available everywhere. So I think we should do more homework on this, so that donor card is easily available. As some speakers suggested, that a donor card, in fact, should be this opt-in system of the donor should be incorporated in the Aadhaar card, or as the suggestion is there that it should be with the driving license also, and the blood group should be there on every driving license. So if Aadhaar card can be linked somehow with this program, it will definitely lead to more awareness. This, as I already has been highlighted, that we have in India, the donation is really much lesser as compared to US, UK, Australia, Russia. So we hardly have rate of diseased organ donation is 9 per lakh of population, as compared to if you see US or UK, and as some previous speakers suggested, that even they speed up this by 3 to 4 fold, we will not require any living donation in our country. So I think that our aim should be to shift to more of cadaver donations, and that only then we can decrease the living donation. Although living donation are as safe and the quality of life is same in patient as well as donor after transplantation, but still the cadaver donation has to be promoted as much as possible. Mohan Foundation is doing excellent job. NOTO is arranging various camps and various meetings, but I think more and more celebrities should come forward, and we have more such activities. Only then we can promote cadaver donation. So my message is that don't take these organs to heaven. God knows that we need them here. So with this message, I again congratulate the organizers for arranging this wonderful webinar. Thank you.
Thank you, Dr. Bhalla. It was a very lucid presentation. You have touched all the finer points, and your slides have shown where we stand right now in the disease donor program, and how we can improve further. A congratulatory message to you as a nephrologist, because you are the people who are the pioneers in developing the disease donor program. Other organs and other specialties have taken over the base which you people have created, and hats off to you guys, the nephrologists. They have really worked very hard in the initial years to develop the disease donor program. Thank you so much.
Thank you, Sairam, and thank you, Bipin, for moderating the session, and thank you, Bhalla, for those very important messages to the public. I think, like you said in the last slide, that you need not take your organs to the heaven. You can as well leave them here for people to be used. I think that is an important message to all of us, and I'd like to thank you for giving us this very exhaustive summary on renal transplantation situation in our country. Our last session is on pancreas transplantation. Pancreas as an organ is not often transplanted. There's less islet cell transplantation we hear of, but not as a pancreatic organ, but still it's a very important area where transplant work is going on. To discuss this, we again have this unique situation of two presidents. We have the president of the Indian Society of Surgical Gastroenterology, Dr. Pradeep, who's also the senior consultant at the Department of Surgical Gastroenterology, Nation Institute of Gastroenterology, and Dr. Shailesh Srikhande, who is the president of the Indian Association of the International Hepato-Pancreato-Biliary Association, Indian chapter. To moderate this session and start the session, we have Dr. Roopjyoti Talukdar, who is the Director of Pancreatic Services at the AIG Hospitals. Roopjyoti.
Very good afternoon, and it's my proud privilege to introduce Dr. Shailesh Srikhande. Dr. Srikhande actually don't need any introduction among the surgical and medical fraternity of the country and abroad. But for the sake of the general public, Dr. Srikhande is currently the president of the Indian chapter of International Hepato-Pancreato-Biliary Association. He also holds the post of Deputy Director of the Tata Memorial Hospital in Mumbai and the Professor and Head Department of Cancer Surgery. Dr. Srikhande is actually very passionate about the pancreas, which had been very close to his heart since his initial training. And he had contributed immensely to the field of pancreatic surgery and also to the field of cancer surgery in general. So he has contributed immensely, more than around 70 articles, peer-reviewed scientific literature about basic and clinical sciences, and over 30 book chapters. In recognition to his contribution to pancreatic surgery and cancer surgery in India, he had been conferred the Fellowship of Royal College of Surgeons in 2014. So I'd like to invite Dr. Srikhande to deliver his talk.
Thank you so much for this fine invitation, Dr. Reddy, and thank you, Roop, as well as good to see Pradeep. It's a real privilege to be here on the occasion of Organ Donation Day. And without much ado, I'll just share a few of my thoughts before we can have some sort of a discussion. I'll share my screen and you have to tell me whether you are able to see my screen. Are you able to see my screen?
Yes. Yes.
So I'm going to give you my thoughts more in terms of my position as the president of the Indian chapter of the IHPBA. I am associated with a lot of research on originally on tropical chronic pancreatitis, and then moved on more and more to cancer surgery, especially with my appointment at the Tata Memorial in 2001. But today I'll give you a viewpoint. Everyone focuses on liver transplant and kidney transplants, but I think this is an area which needs a lot of attention. And in the next 3 or 4 slides, I'll try and tell you why. Now, this is the situation of diabetes around the world. You will see the percentage of people who die from diabetes before the age of 60. And you see the orange, which is in Central and South America, large parts of the Far East and Northern Africa, as well as the Indian subcontinent. 40 to 60% of people in our part of the world are going to die from diabetes, unfortunately, before the age of 60. And half of the 4 million people who die from diabetes are unfortunately under the age of 60. And this is documented data, more so for an LMIC like India. We should not forget that India continues to be a part of low and middle income countries, and we are not a middle income country as yet in terms of WHO classification. And you can see the impact when it comes to loss of life from the diabetes capital of India, where we are expecting about 10 crore people with diabetes by 2030, unfortunately. Now, when we speak on World Organ Donation Day, let's look back to remain humble and to understand what our direction needs to be for the future. So this is the history of pancreas transplant, and the pioneers were David Sutherland and Hans Solinger. And you can see that they did undertake this way back. And this is, half a century ago that people have succeeded in being able to do successful pancreas transplants. The initial times were not easy, with people dying in 9 days and 4 months after a transplant. But today, 94% of people are alive at the end of 1 year after doing a pancreas transplantation or after undergoing a pancreas transplantation. What is the situation in India? Well, it's high technology and it's still evolving. But we have seen in the last 20 years how liver transplantation has taken root in this country. And I expect the same in the next 10 years for pancreas transplantation as well. I've listed the cities which have done pancreas transplantation, but I think in terms of a series which has been published, and it has been most recently from the AIG group in the Indian Association of, in the Indian Journal of Gastroenterology. And that's very encouraging to know that we are moving in the direction of pancreas transplantation. Having said that, since 2014 till now, the number is quite small, especially when you realize that worldwide there have been about 60,000 pancreas transplants so far. But beyond pancreas transplantation, which is a major surgical procedure, very often it is done along with kidney. Sometimes it is done in isolation, but perhaps the best is when you do a simultaneous kidney pancreas or pancreas kidney transplantation. But the other concept which is likely to gain root is going to be something like deceased donor islet allotransplantation or auto islet allotransplantation. This involves certain technologies, but these are available, these are possible. So I think we will be moving more and more in this direction to try and help a whole number of patients who are affected by metabolic syndromes, diabetes, various forms of tropical chronic pancreatitis, with patients having both endocrine and exocrine challenges. This is not going to be a lecture to educate through all the processes and indications for pancreas transplantation. This is on the occasion of Organ Donation Day. So I think this is going to be the direction where we will also move. And I will tell you why. If you look at islet transplantation, it's relatively a minor procedure. A pancreas transplant is a major undertaking. We can technically do it. We have done this and we will do that as well. But the risk of complications is much less with an islet transplant. Immunosuppression, of course, is there in both. You will require multiple donors for getting a good yield of islets, but you can get insulin independence for about 1/3 of patients for about 2 years. You will have good quality of life in terms of hypoglycemic events. The secondary complications, this is still an evolving specialty and we do not know how things will evolve. It is not as old as conventional surgical pancreas transplantation. In a nutshell, this is my last slide before I close my talk. What are the benefits of doing a pancreas transplantation? You're going to get protection from hypoglycemia. There's going to be freedom from insulin, diabetic diets, as well as glucose monitoring. You will be able to stabilize or arrest the retinopathy as well as the neuropathy. You will have reduced future diabetic nephrosclerosis. You will also have a normal exocrine function. But I think most importantly, we will be able to improve quality of life of these patients who face these crippling problems, and we will also improve survival. So I would close by saying that the future of pancreas transplantation for a vast country like India, which is 1.3 billion, which is unfortunately the diabetes capital of the country, clearly we need to do a lot more number of pancreas transplants surgically, as well as islet cell and other forms of pancreas transplantation. And that's where we would be moving in the next 1 decade. With that, I would like to close my talk. Thank you very much for this invitation to share with you my thoughts on this day.
Thank you, Shailesh, for his lucid talk on the magnitude of the problem and the challenges of the pancreatic transplant and the future directions which you have addressed in your talk.
I can't hear you well.
I echo your view, saying that the pancreatic transplants lag behind compared to other solid organ transplants. The reason being probably it is the donors, availability of the donors, and the complexity of involved with the whole organ pancreatic transplants, and of course availability of the hypoglycemic drugs probably did not encourage of pancreatic transplants as a whole compared to other organ transplants. But we know, as you rightly said, that India is going to be the diabetic capital in the world, and you are seeing more and more juvenile diabetics nowadays. So the future is going to be organ transplants, particularly islet transplants is going to be the future. So probably we do require more organ donors for these pancreatic transplants to tackle this problem in the future. And I'm sure the technology, the advances are going to make this possible in future. Thank you.
Thank you, Pradeep. Thank you, Roop.
Thank you.
Thank you, Shailesh, for that very crisp talk on the current situation of pancreatic transplantation. This has been a very unique session where 8 presidents, current presidents of the top medical societies of our country have participated to give messages about various organ transplantations. And I think these messages have been both very educative, very promising, and hopeful that our country as a whole would move forward in this day of World Organ Donation. I think we should rededicate ourselves to patient awareness, to seeing that more and more organs are available for many of our diseased patients. As you can see, the gap between what is available and what is done is huge, and this gap hopefully will become smaller and smaller. To conclude this session, I'll request my colleague Dr. G.V. Rao, who actually conceived this program, to give his remarks. Dr. G.V. Rao has been the past president of the International Society of Hepato-Biliary Pancreatico-Biliary Society of Indian chapter. He is also currently the director at AIG. G.V.
Thank you so much. At the outset, actually, on behalf of the faculty and staff of AIG Hospitals and Asian Institute of Gastroenterology, I sincerely thank all the presidents of all the major societies who have participated in this meeting. You all agree with me that this is the first ever time that so many presidents of major societies have come onto one single platform to convey the message regarding the need of the hour, need of organ transplant, need for organ donation, in India as compared to what has been happening across the globe. My sincere thanks to Abhay Dalvi, President of the ASI, Dr. Mohanan, who is the President of the Cardiology Society of India, Dr. Behera, the President of Indian Chest Society, Dr. Rakesh Kochhar is the President of Indian Society of Surgical Gastroenterology, Dr. Bhalla, who is the President of Indian Society of Nephrology, Dr. Shailesh Srikhande, who is the President of IHPB Indian Chapter. And not only that, I think I should also thank two of our presidents from our own department. Dr. P.N. Rao is the President of INSL, and Dr. Pradeep, who is the President of Indian Society of Surgical Gastroenterology, to be sharing this platform and giving this message, which is very, very loud and clear, that there has been a lot of gap between the availability and the need. And this is basically because of the success of the transplantation program. So the message seems to be very, very clear. Coincidentally, actually, if you see, I'm also surprised to see that majority of the presidents who are occupying the chair seems to be from the prestigious medical college or the institution in India, the PGI Chandigarh. Dr. Reddy will agree with me that 80% of the people who are occupying the chair of the presidents of the society seem to be from PGI Chandigarh. And coincidentally, the chairman of our hospital, Dr. Reddy, is also an alumni and has also been the past president of WO. I hope this message is very clear. I hope it reaches the public. And we do hope that the organ donation will be in an increasing spree, and it would benefit a lot of those patients who are in need. Thank you once again, all the participants, all the faculties, the audiovisual team at AIG Hospitals who have taken this time out, and then I hope that the messages are very, very clear. Thank you so much once again for logging on to this session from AIG Hospitals, Hyderabad.
Thank you.